Om Swastiastu, we're from SGD B1, and in this opportunity we're about to presentate our student project about management of iron deficiency anemia. Next. And this is our team members. Next.
Hello my friends, so my name is Natsura Kawistu, student number 135. I would like to tell you the background of our student project. So anemia is a functional inability of the blood to supply enough oxygen to our body tissues. So anemia is basically like a manifestations of the underlying disease. Anemia, based on the laboratory findings, divided into a lot of divisions. So what we're going to talk about is the iron deficiency anemia, or IDA. It is one of the nutritional anemia led to the deficiency of B12 and folic acid. Patients with ADA may develop symptoms such as glossitis, angular cellitis, esophageal webs and strictures, chylosias, sclera, gastric atrophy, and pica. To diagnose IDA, more laboratory findings such as CBC, pleural blood smear, serum iron, TIBC, transparent saturation, serum ferritin, and bone marrow aspiration. So you can go to the next slide.
Hello, my name is Putri Agnes Monica with last number student 100. So let me explain about the therapy for iron deficiency anemia. So the goal of therapy iron deficiency anemia to supply the sufficient iron and repair the hemoglobin deficit and also replenish storage of iron. There are two basic treatments for iron deficiency anemia. First is oral iron replacement and second is parenteral iron. So the oral iron is the first choice for all patients with iron deficiency anemia because of the effectiveness, safety, and also economy. The most common oral iron for patient is ferrosulfate for 3 until 6 months until the patient condition improves. And the recommended dose is 60 mg of elementary iron 3 times a day for increase the erythropoiesis mechanism. Oral iron preparation should given when the stomach is empty, but oral iron also has side effects like nausea, vomiting, and constipation. And the second is the treatment of iron deficiency anemia with iron parenteral, used when patients have impaired or problems with absorption in the gastrointestinal tract. And for iron parenteral therapy, we can give with a large dose for patient at a time, but has greater risk of side effects and toxicity such as allergic reaction and anaphylaxis. And the last, for the blood transfusion, we are need to prevent cardiac or cerebral ischemic in patients with severe anemia with hemoglobin under 7. Thank you.
I'm Vicky Samantha, student number 079. So these are the problem identification. First, what is the definition of iron deficiency anemia? Then the symptoms. What are the symptoms of iron deficiency anemia? What are the risk factors and complications of iron deficiency anemia? And how to manage and prevent iron deficiency anemia. The purpose are the importance to understand the definition of iron deficiency anemia, the importance to understand the symptoms of iron deficiency anemia, the importance to understand the risk factors and complications of iron deficiency anemia, and the importance to understand how to manage and prevent iron deficiency anemia. The significance is, after understanding the definition, symptoms, risk factors, complications, management, and prevention of iron deficiency anemia, written in this paper, the clinician will be able to know how to manage and give effective treatments to patients with iron deficiency anemia and ways to prevent it.
My name is Rosabaluddin Priyatna with student number 115. So we start with the definition. Anemia is a condition when the body doesn't have enough healthy red blood cells. There are many types of anemia. One of the examples is iron deficiency anemia. Iron deficiency anemia occurs if one doesn't have enough iron in the body. Mineral iron is a very important component to maintain many body functions, including production of the hemoglobin, which is the molecule in the blood that carries oxygen. The diagnosis of iron deficiency anemia is confirmed by the binding of low iron stores and hemoglobin level to standard deviation below normal. And this occurs because of inadequate iron intake, decreased iron absorption, increased iron demand, and increased iron loss. And iron deficiency anemia can range from mild to severe. People with mild with mild or moderate iron deficiency anemia may not have any signs or symptom. Symptoms generally worsen as the anemia becomes more severe. Thank you.
My name is Christian Basintalo, number 075. Risk factors. These groups of people may have more risk of iron deficiency anemia. First, women. Because women lose blood during menstruation, in general, women group has greater risk of iron deficiency anemia. Next, infants and children. Infants, if they were born with low birth weight or born prematurely, who don't get sufficient iron from breast milk or formula may be at risk of iron deficiency. Next, vegetarian. People who don't eat meat may have a greater risk of iron deficiency anemia if they don't eat other iron-rich foods. And then, frequent blood donors. People who often donate their blood may have an increased risk of iron deficiency anemia, since blood donation can deplete iron stores. And the last one is family history. Von Willebrand disease is a genetic bleeding disorder that affects the blood's capability on clotting. And next one, the complications from iron deficiency anemia. So this condition can lead to more serious health problems if don't get well treated, including heart problems during pregnancy, and growth problems. Thank you.
Hello everyone, my name is Jatimotel Kurnia with name 006. So now I'm going to explain about the sign and symptoms of iron deficiency anemia. For the sign, it is consisted of brittle nails or spooning of the nails, crack at the side of the mouth, pale skin, and swelling or soreness of the tongue. For the symptoms, it is consisted of chest pain, coldness in the hands and feet, difficulty of concentrating, dizziness, fatigue, headache, irregular heartbeat, pica, or unusual craving for non-food items such as ice, dirt, paint, or starch. The next one is restless leg syndrome, shortness of breath, and the last one is going to be a weakness. Thank you.
Hello, my name is Udayana with 3 last digit student number 032. Ferrous sulfate are often used for oral treatment. Ferrous gluconate, ferrous fumarate, and ferrous kinate were equally well absorbed. For babies, iron preparation are available in drop form. The dosage of the drug is calculated based on the elemental iron content present in the ferrous salt. Too large drug dose will cause side effect on the digestive tract and do not provide a faster healing effect. Iron absorption is best when the stomach is empty between 2 meals, but can cause gastrointestinal side effect. The drug is given in 2 until 3 doses a day. This action is more important because it is acceptable to the body and will increase patient compliance. This iron preparation should continue to be given for 2 months after anemia in the patient is resolved. Thank you.
Good afternoon, my name is Claudia, I'm number 58, and now I will explain about the management of iron deficiency anemia using the enteral way. The enteral way is not often favored because of its severe side effect. It is also very expensive, very painful, and it is very lengthy and very frequent in the administration. Even though so, in some unresponsive patients, it has to be used.
Good afternoon, my name is Bella Sarsati, number 150. So another management of iron deficiency anemia is blood transfusion, which rarely needed, but it is required in condition of very severe anemia or weight infection. In patients with hemoglobin below 6 to 8 grams per deciliter, blood transfusion are usually performed, especially in pregnant women with conditions that endanger the fetus or the mother herself. Blood transfusion also performed for patients with unstable hemodynamics, active bleeding, and organ ischemia due to severe iron deficiency anemia. To perform the transfusion, we need 2 units of paired red cell or PRC 300 ml. PRC shouldn't be given immediately because it will be dangerous, which can cause hypervolemia and heart dilatations. So we give PRC slowly and amount sufficient to raise the hemoglobin level to a safe level while waiting for a response to iron therapy. For patients with severe anemia with an hemoglobin level of less than 4 grams per deciliter, PRC is given at dose of 2 to 3 mg per kilogram body weight per 1 administration, accompanied by administration of diuretics such as furosemide.
Hello everyone, my name is Udayana with last year student number 105. So the prevention of iron deficiency anemia is focused on maintaining iron level in the blood and focused and the integrated approach to combat micronutrient malnutrition. We can do it by dietary iron, by taking iron supplement as well as iron food. By taking iron supplement in pregnant women, we could take at the dosage of 30 to 60 mg of elemental iron. In infant born at 37 weeks of age or below, we could take 2 mg per kilo per day in addition of breastfeeding. And in infant age 4 to 6 months, we could take at 30 mg per day, and in adult, we could take at a dose of 60 mg per day of elemental iron.
Hello, my name is Chakra Sintan Lamsawati with 3-digit of student number 231. So in addition to providing iron supplements, the prevention of iron deficiency can also be done by intake foods that contains iron. So the first one is by eating nutrition-rich foods. It can help in maintaining iron levels in the body in children, adolescents, and adults. The second one is increasing the consumption of vitamin C by 25 milligrams, 50 milligrams, 100 milligrams, and 250 milligrams. It can help increase iron absorption. So in improving the bioavailability of foods, iron is also thought to be capable of maintaining iron levels in the body. So the third one is we need to reducing the consumption of reduced iron absorption food, because some foods that can inhibit the absorption of iron, such as phytate, phosphate, and tannin. And it's really necessary to pay attention to the side effects too. Next.
Alright, lastly but not the least is the conclusion. Iron is a very important component to maintain bodily function, including production of hemoglobin, maintaining healthy cells, skin, hair, and nails. Iron deficiency anemia develops when body stores of iron drops too low to support red blood cell production. The diagnosis of IDA is confirmed by the finding of low iron stores and a hemoglobin level 2 standard deviations below the normal. IDA occurs because of inadequate iron intake, decreased iron absorption, increased iron demand, and increased iron loss. Common symptoms include swelling of the tongue, paleness, tachycardia, and body weakness. Risk factors include being women, infants, vegetarians, and frequent blood donors. Complication includes growth problems, pregnancy problems, and heart problems. Management is divided into oral, enteral, and transfusion. Oral ferrous gluconate, ferrous fumarate, and ferrous succinate were equally well absorbed. Next is the enteral. Although it is difficult and expensive, enteral route could help in certain cases. In patients with hemoglobin below 6 to 8 grams per deciliter, blood transfusions are usually performed. Some foods can inhibit the absorption of iron, namely phytate, phosphate, and tannin. And that concludes our presentation for today. Thank you for your attention.